that is for blood products. Now, as such, I'm not sure. Okay, check it now. Most probably it must be visible now. Is it visible? Check it, Sanika, again. Most probably. Most probably. Okay. I'll share it again if required. Okay, check it now. Fine. So we know about something about there are things related to blood donation. We know blood is a very important connective tissue, and that connective tissue is responsible for many functions. Some of these functions we have seen while going through the topic of anticoagulant and while going through the topic of the hematinics, and also as a students of physiology, you might have studied what are various functions of blood, and that time you might have seen there are many function blood is doing, and it's very important, very crucial, and anything which is affecting related to blood, may it be blood volume, may it be the blood function, like we have seen as case of anemias, or may it be related to immunity, there are whatsoever function it may be, then in all cases it can affect a lot to the person. So we know that what happens, how the blood donations are done, because many times you might have seen blood donation is done, and it's not that much important for us, but it helps us to understand. So blood is there, blood donor is there, then some questions are asked, like body weight, about diseases, etc. And according to the this question is various questions, then copper sulfate method, which is a quicker method, hemoglobin is checked. If hemoglobin is adequate, appropriate, then it is allowed. Blood pressure, pulse, everything, and then accordingly the person is allowed, and simultaneously it is tested for these things, HIV, hepatitis, syphilis, etc., blood group, and any other antibodies are present. And then the blood, whatsoever donated blood is accepted. Now, why we discuss this, although it is not part of our syllabus, why we did discuss it? The reason is, now whatsoever blood which is there, we know that blood donation is done, and because of this, the blood is made available to the needy person. Okay. Now, some time before many of the techniques which we are going to see now, when before they were developed, there was a situation that this blood, after the expiry date maybe of 30 days, it was getting wasted and it was almost thrown away. Nowadays, when it was understood that yes, we can utilize some of the components of the blood, and rather when the blood is being given, or that is what we can say, the transfusion is done, maybe everybody is not requiring whole blood, somebody is requiring some important fraction of the blood, and therefore the once it was understood that only some fraction is required, now in that cases people work on that, and they have developed a process of fractionation of blood. Okay, so we'll see that what happens. So in that, so when well blood is coming, in some patients directly whole blood is given, but if it is not, then what it can be separated from that, granulocytes can be separated, red blood cells can be separated, plasma can be separated. From that plasma, there are two fresh frozen plasma, is FFP, is very commonly, you may see it somewhere in therapeutics. Then cryoprecipitate are the precipitates from the plasma. Cryo is very cool. After cooling, it is frozen. Then platelets are there, granulocytes are there. Then this plasma is further fractionated. So here cryoprecipitate is there, that can be given. Then we have seen problems in the person. If we have seen as anticoagulants, that when coagulation is more, or when that is beyond the limits, and that is causing problems of ischemia or thrombosis, etc. But there may be persons like hemophilia and such kind of diseases where their patient may not be having sufficient clotting factors. So these clotting factors are separated. Then next is this cryoprecipitate, which is containing factor 8 concentration is there. Albumin is an important protein which is present, and it plays very important role. Immunoglobulins are actually antibodies, we know. So these various immunoglobulins are there. Example of these are gamma globulin is there, hepatitis B, IgG is there, rabies there, and many such antibodies are there. So if the person is having this, antibodies may be separated and can be administered to the patient. So next in that is, what are various blood components? We are not seeing now in a physiologic perspective, we are seeing it in a perspective of pharmacology, or in a drug perspective. So blood products are whole blood is there, packed red cell RBCs are there. From this fractionation above figure we are making is a list. WBC concentration can be there, or plasma products can be there, that is FFP, that is fresh frozen plasma, as I told you. Frozen plasma is there, which is not fresh, so we call it as a frozen plasma. Cryoprecipitate is there. I told you plasma is precipitated under extreme cool condition, cryo is cool. Then albumin containing solutions are there, human immunoglobulins are there, which are, these are antibodies. Prothrombin complex concentration is there, factor 8 concentrate are there. So this is the list of blood components which are available and how they are done. So from whole blood, centrifugations are there. So platelet rich plasma is there, that is separated out. From that again centrifugation is done. So platelet is separated out. Platelet is poor plasma, means the plasma without platelet is there, it is frozen, and thus we get frozen plasma. Then next thing in this is from that fresh frozen plasma, again we do cryoprecipitation at 4 degrees Celsius, and then because of that the precipitate is there. In that precipitate factor 8 is present, that is called as a factor 8 concentrate or cryoprecipitate, anything you can call. Then there is a supernatant. From this supernatant again there is a separation, and from that precipitation, that is fibrinogen is separated out and precipitated out. From that supernatant you can get prothrombin complex, you can get immunoglobulins, and you can get plasma protein fractions or albumin. So these are variety of things which are available. This is purely from blood. One more thing is there which you might have studied in pharmaceutics, we call them as plasma expanders, and these are the carbohydrates like dextran and all. So these are the agents which impart viscosity to blood when it is not sufficiently there. It helps into maintaining the blood volume particularly. So these are the agents which are used in various conditions. We shall see one by one. What is whole blood? It is not commonly indicated nowadays. Earlier it was only the source. It is best if transfused as early as possible after donation, that is within few hours. Okay, but if it is not possible, then normally it is fractionated, and the components like platelet, clotting factors can be given if they are separated. Okay, now what happens? Why this fractionation? Because there are some which can be having good stability up to certain temperature. In some cases, some of them are requiring very high cooling or very high freezing rate. So in that case, it's not feasible because it is a cost is involved, storage is involved. So for every that bigger cooling, instead of cooling whole blood, only that much fraction which require very high cooling for storage, that can be done. So that will be available in small volume, and other volume will be taken away and can be used for other purpose. So component like platelets, clotting factors, they get deteriorated within hours of the donation. So they need to be fractionated or separated as early as possible. When we are using it, when there is a massive blood loss, if you remember, we call it as a vicious circle, that when there is a severe blood loss, then organs are receiving less blood supply because of hypovolemia, and because of that, this hypovolemia, even heart is functioning less, and slowly, gradually, all organs are getting less blood supply, hypoxia, and slowly it causes a problem. So in that cases, to bring it to a normal cycle, you need blood, so that it can be there. Then exchange transfusion in neonates where there are problems, where the sufficient is not there. Then red cell transfusion where no red cells are available in that cases, because only example in hemophilias and other situations where RBCs are having problem, or maybe sickle cell anemias. So in that conditions, blood can be given, but the problem is, if possible, we can give fractionated thing. We know about blood grouping and how it should be given. I'll not give it detail because you know about it. Okay, then second is important is red cell concentrate. We have seen it is also made. It is indicated to improve the tissue oxygenation that is impaired by anemia or hypovolemia. And in normovolemic anemia, it is important. Blood volume is normal, but cells are less, so we can give only concentrate. Now this is benefit is what, if already person is having normal volemia and we are giving whole blood, so it is increasing the blood volume. But if we give the concentrate, then it is not increasing blood volume, it is just improving the cell count. So that is what the benefit is there. In ongoing anemia where volume has been replaced with crystalloids or other colloids. Crystalloids and colloid means, as I told you, dextran and such kind of things, which are used as a plasma expander, particularly in hypovolemia. So hypovolemia is corrected with plasma, this dextran and something, but they don't have cells. So in that case, to make the cells into it, we can give plasma, that is plasma expanders, which are making the volume, and plus cells packed these concentrates, so that RBCs are also available. If only we give dextran and such thing, that is plasma expander, then they will increase the volume, but they will not make the level or make the level increase of RBCs. Now that is sort of anemia developed. Okay. Now to treat that anemia, you need the RBCs or this red cell concentrate. Then next is the platelet concentrate. That is 1 unit. Let me make it. So only 1 unit contains around this much, that is 50 multiplied by 109 platelets. 5 to 6 units are given as a one pool. And it is indicated in bleeding due to platelet deficiency, bleeding because of the platelet dysfunction. You may be knowing there are some problems, in what cases platelet count goes down. Anybody has gone through, somewhere heard about any medical condition where platelet goes down? Very famous. Yes, Sally, correct. Yes, Akash, thrombocytopenia. But the thrombocytopenia is usually nowadays, many news you can encounter that dengue is causing thrombocytopenia. So in case of dengue, we can use platelet concentration. I hope it's clear now. So this is the situation. Then next is what has to be care has to be done already. If whole blood is there, then everything has to be checked. Slow transfusion, no real need of warming if very small concentration is given. And normal saline can be given along with Y type of infusion set. That means from one side concentrate will go and from one side saline will go. They can be available as pooled one, which are separated like apheresis, or single donor stored at room temperature. Now, at many places, what is advocated is because nobody knows that what kind of blood the other person may have, and if it is required, then at many places it is advised that donate your own blood before somebody says that somebody has to go for surgery. Then donate your own blood before that. Keep it that they will make it fractionated and you can use same blood. So that is single donor blood. Or like that single donor, if they are relative and can give multiple units, then from that it can be taken. Okay, and it must be transfused at once. Complete transfusion within 20 minutes should be done. Then next is, what are indication? Already we have seen about this, bleeding due to thrombocytopenia, which may be secondary to defective production of these platelets during aplastic anemia, leukemias, defective platelet functions, congenital platelet disorder, and apart from that we have just now seen dengue and such thing. Okay, increased platelet consumption, then disseminated intravascular coagulopathy, dilutional massive blood transfusion. These are some of the indications where we need only platelets. If what precaution one has to take when we have to give platelets? Give platelets that are ABO compatible wherever possible. Although platelets are not implicated in any kind of groups, we have seen that they are RBCs, but still they can have the complex activities, and therefore it is better to check it and make it in that way, that is give the platelet that which are compatible as per the ABO grouping, as we have seen in blood groups, not indicated in certain conditions like pregnancy related conditions. Using special platelet infusion set is required for that. Okay, and risk are similar to that of whole blood and the RBC concentrate whatsoever we give. Accordingly, same risk are there with this. Okay, so platelet already we have seen. I think I have made it. Next is WBC concentrate. It is difficult to get sufficient quantities. Half-life is only 8 hours. Rarely indicated because most patients respond to antibiotics and do not need white blood cell. Non-hemolytic transfusion reactions are common with WBC concentration. You can understand in what condition we can give them when WBCs are less in certain viral and certain conditions. And again, particularly where the person is fighting with the infections and WBC's count has affected, in that cases we can give it. Other things are there like plasma products are there. Most important, you will encountering it at many times. That is called as a fresh frozen plasma, FFP. It is stored at minus 30 degrees Celsius. Shelf life is 1 year after that. That's what I was trying to tell you, that it can be now stored at 1 year, but it is minus 30 degrees Celsius. And whole blood you cannot keep to minus 30 degrees Celsius for this much time, because it will acquire big volume and cost will increase unnecessarily. It is rich in all components of plasma, and it is indicated in many conditions like intravascular coagulation. Disseminated means at multiple places or which is spread throughout the body. Therefore, we call it as a disseminated intravascular coagulation. In liver failure, when you will go for GIT, particularly cirrhosis and all, during that you will encounter this. FFP is one of the very important part of treatment. In warfarin overdose and massive RBC transfusion, if RBCs are too much transferred, in that case it is there. Then cryoprecipitate is one more thing, and this is prepared from FFP after thawing, because it was minus 30. So it has to be warm. Warm is minus 30 to 4 degrees Celsius is a warming. So when it is refrozen, the shelf life is around 3 to 6 months. It is rich in factor 8, factor 12, factor 13, and 1 Willevant factor, which are very important factors in blood coagulation, which we have seen earlier. Then the factor 8 will concentrate is available. It is prepared by fractionation of this cryoprecipitate. Large number of cryoprecipitate are required for that, and they are indicated in the treatment of hemophilia, that is type A type of hemophilia. Then next in that is, I hope you are understanding. I am not sure about whether this is there mentioned in syllabus or not, but definitely during therapeutics you may encounter this, and therefore I am trying to take it so that at least you have gone through it. Therefore I am trying, maybe 1 or 2 lecture we may use for this, but yes, it should help you. Then next is prothrombin complex concentrate, is one more type, and it contains the factor, the 2 factor 7, factor 9, factor 10. Again it is indicated in hemophilia, but this is in hemophilia B. Okay, then 5 type of human immunoglobulins are there. They are non-specific immunoglobulins, and they can be used in congenital immunodeficiencies, means the person is having very less immunity. Acquired immunodeficiencies, example HIV, where there is acquired immunodeficiency. Idiopathic thrombocytopenia purpura. Okay, and then specific immunoglobulins are used in hepatitis B, herpes zoster, rubella, rabies, tetanus, measles. In that the specific immunoglobulin, if it is known that the person has got good antibodies or immunoglobulins, then from that, just like nowadays for corona is going on, isn't it? Plasma therapy. Why plasma therapy? Because the person who have got cured from corona, they have got antibodies against it. That is, these are the immunoglobulins, and these immunoglobulins, if it can be passed, that can act as a treatment for other people. Then next is albumin. Albumin is an important protein which is available, and it is playing a very important role in maintaining blood osmotic pressure, blood viscosity, and many other functions. So it is used as a plasma expander. This word you may keep, because I have used this word many times now. Plasma expander, apart from albumin, there are other also. Example, I told you dextran and many such polysaccharides are there. So they are used to maintain plasma albumin level in liver failure, malnutrition, and the states where the person is losing protein. Then next is about blood groups. I will not go in more detail. Fresh frozen plasma, I told about it, what kind of it is, and what has to be done. I think I have covered most of the thing. Remaining we shall cover later, because these are the things which are important and how they are used. So let us. I'll go through it. I'll make note again, and if anything is remaining, I'll add into it and I'll put in. Okay. So here we have taken a small review about the drugs which are